Jack at 4:30, hearing loss as we age. You know, according to AARP.org, nearly 27 million Americans 50 or older have trouble hearing. Joining us today is Dr. David Huff. He's a local audiologist and he's an expert in this field. And thanks for joining us. We know that the Huff Center was named after your father.
Yes.
So it's all in the family, apparently. Signs that we're losing our hearing can come gradually. It can come all of a sudden. What are those signs that we need to be aware of, and maybe more importantly, our loved ones need to be aware of in us?
Well, when you might complain that others are mumbling, and actually maybe your ears that are causing the problem, your hearing, and the family may be complaining, and you find yourself turning the TV up if this TV program is turned up too loud,
Right.
and for others' comfort, then you may have a hearing loss. So things like that. Also, of course, in group situations, you may really struggle hearing, and so folks many times begin to withdraw socially and kind of pull back. And so my father, Dr. Jack Huff, called it the silent hurt, is what he called hearing loss, because it does come on gradually, and many times you don't even notice it yourself. You just find yourself withdrawing socially.
Interesting. What are some of the more common causes of hearing loss?
Well, just as you mentioned, aging, presbycusis is what they call it. So in the general population, about 10% have a hearing loss, but 65 and older, those numbers shoot up 30%, and 75 and older, 50% have hearing loss. So aging is a factor, noise exposure, of course, and a family history of hearing loss.
And could hearing loss actually lead to or be a symptom of something more serious?
Yes, it certainly could. Middle ear infections, of course, used to be killers back before the age of antibiotics.
Exactly.
But also cysts can grow in the middle ear. Cysts can grow on the hearing nerve, pressing on the balance nerve as well. And those cysts can be life-threatening, cholesteatomia and acoustic neuroma. So
that's important to know about that. What are some of the best treatments for hearing loss?
As far as treatments go, hearing loss is due to aging and presbycusis and a sensory neural hearing loss. Hearing aids are the best treatment that we have. Unfortunately, there's no medication or surgery that can cure a sensory neural hearing loss. But hearing aids are just that, an aid, so they don't fix the hearing, but they can help significantly and improve quality of life. So hearing aid technology has advanced quite a bit, and so the big issue has been background noise and hearing aids just amplifying anything and everything. And so now the technology has become more and more sophisticated. Sometimes that comes with a price, though, with the research and development that goes into that.
But it'd be a great investment. Doctor, thank you so much for joining us today. We appreciate it very much.
Thank you.
Integra's Cochlear Implant Clinic is offering complimentary hearing screenings for people who haven't been diagnosed with hearing loss. The screenings are free, but you do need to schedule an appointment. You can call the clinic at the number right there on your screen.